hiding in the back.
For you.
Well, he's our local primary physician at this location. He's also bilingual, just in case.
Necesita hablar en español, yo puedo.
Stand.
I know any other language.
Well, that is bilingual. More than one. More than one. Just give us, I guess, at least a few more moments. We'll get ready to set up. We're almost ready. We're good? Okay, excellent. Then we're going to start it again. Thank you so much, everyone. Thank you, Dr. Gilligan.
All right, I'm Kristina Wilson. I'm a physical therapist. Our company is called KAIZEN Total Wellness. We are a part of the MAXhealth group. We have 3 locations right now, one in Lakewood Ranch, one in West Bradenton, and one in Sarasota on Bee Ridge. So I will be talking about back pain. As I see a lot of these MAXhealth doctors' patients, they're our main referral source. So back pain is the #1 problem of pain that people go to seek out their doctor. They say over 3 million cases a year occur. And it's the #1 reason why people will skip work for pain. So it is a big part of our healthcare system, a big part of our economy, and a big problem that is difficult to address because it's a difficult problem. This is our spine. So with spine, we have bones. We have our discs or our shock absorbers in between. And then at every single level, we have nerve roots that exit. There are a number of ligaments and muscles that attach and support the spine. There's over 140 muscles that help to support our spine. So muscles can be a big part of pain and pain relief. Because there are so many parts of the spine, that leads to a lot of parts that can be painful, and painful for different reasons and in different ways. Some of the most common problems for back pain are muscle problems. This is an easy muscle sprain, an ouch. Those are typically something that really goes away on its own. You can have disc problems where the disc herniates or bulges. It's shown by this red part. Or you can have disc narrowing, where these good supportive cushions aren't as thick as they should be. Then you can have bony problems, where you have arthritis back here, where the actual bones come to meet each other. These are our joints of the spine. This is where we get the motion to the spine, back here at the joints. The front side is very stable. There's a big thick ligament that runs all the way along the front. So if we have problems, it's typically back here. Then these nerves also serve problems a lot of the time. They can get pinched for a variety of reasons. They can get pinched because the disc herniates and pushes on it. They can get pinched because the discs aren't as thick, which then leads the bones to be closer together. Those bones can then rub on the nerves. At any time, if you guys have any questions, feel free to stop me and we'll address them and then go on. So what do we do to fix all of this back pain that we have? There's a big variety. #1, if it's something that's acute, that's come on quickly, you can ice, you can rest a day or 2. Resting for 2 weeks is counterproductive. The spine really relies upon its muscles for stability, and so if you rest too long, they get weak, and then they aren't as supportive to the spine. Bracing can be done. Again, you don't want to wear it too long. I've heard an hour or 2 a day. Longer than that, the muscles then come to rely upon this brace, and they're not holding themselves up like they should be. But in acute pain, it can definitely be something that helps. Then your over over-the-counter medication, Advil, naproxen, Motrin. These are all anti-inflammatories. Inflammation is typically a problem that comes with back pain, so they can be good at addressing that. A lot of people can't take them if you're on blood thinners or have heart medications, so you want to make sure that those are okay before you choose to take them. Tylenol is the one that's different. It does not have anti-inflammatory, which makes it safe for pretty much everyone, but it won't address that inflammation if you have it.
What causes the inflammation?
Inflammation is just a byproduct of us trying to heal. We get an injury and the body sends in all these products that cause inflammation, and that's what tries to help us get better, but it also gives us pain. So we try to target it to reduce pain that way rather than just pain receptors. So, good question. Then after rest, ice, heat can be good. I like heat for muscular troubles. If it feels really achy, stiff, sore, that heat increases the blood flow and helps things to move a little better. Then I like ice for something that's very acute, new, sharp, or bonier areas. You can definitely alternate. Some people like to do that. Heat and then ice is the order to go in. 10 or 15 minutes at a pop each one. They can be done multiple times a day, 3, 4. It can be done almost once an hour if it's hurting that much. And then let's talk about my favorite topic, physical therapy. In therapy, we can do a number of things. We can do stretches. We can do strengthening exercises. We can do simple just pain relief things. We use an ultrasound and an electrical stimulation. They help to reduce pain, help healing occur, reduce inflammation. The best way is to go see your doctor, talk to him about or her about your type of back pain, and then see a physical therapist. Many exercises can also be done at home or in gym facilities. I don't have a whole lot of equipment in my therapy offices, and I love it that way. I use a lot of chair exercises or laying down, simple things that I know that you can do at home to continue. If pain problems come from something structural, which is very common, arthritis, degenerative disc problems, stenosis, our structure kind of is what it is. If you have arthritis, the arthritis doesn't go away magically, but these things can help to fix what's around the spine, help the muscles to support the spine, help take away pain or tight muscles, and they can really do a lot to decrease symptoms, while you still probably have to watch your back and know that you have a back problem there.
What if you have all three?
What's that?
What if you have all three? Arthritis, stenosis, and
That's
discs.
That's the combo. Then it's just that your back is a little bit worse than some others, but it can definitely improve. I don't think that you need to live with back pain all the time, and that it needs to stay as bad as it is.
So how do you make it better?
If with those kind of, let's talk about degenerative problems, because they are the most common. With that, you have a narrowing to the spine. So, talking low back, we have a curve in our spine, but then as we stand or walk, this curve is kind of accentuated. Different parts are that gets squished or pressure put upon it. So, typically for people, sitting is an easy fix. It opens up that back and it helps take the pressure off. We can't sit all day, nor do we want to. Strengthening of the muscles around the spine helps to take the pressure.
Is that what's called stenosis in the back?
Net narrowing.
That's the stenosis. Okay.
Yep. And you don't want to push standing and walking things. If 5 minutes, all right, it's hurting, take a break, listen to it. Pushing it doesn't make it get better. But gaining strength and stability can make it better. You also learn some tricks of the trade. When it hurts, sit. If you're standing in the kitchen, getting 1 foot up in the kitchen cabinet, the door open, can help take some of that pressure off of the spine. Sometimes it's just a little lean forward that can help. We use an exercise called a pelvic tilt. So you're taking the arch in the back and you're flattening that spine. Helps open up the spine. I could stand here all day and hold that while I was standing, and it would help to alleviate some of that pressure. Traction is a very big tool that's out there. Traction comes in forms of manually done, big machines. One popular one is called the VAX-D. The traction is old school. In 1940, they used to put you in the hospital for a week on traction, and you never got out of it. Yeah, and it works. It's something that hasn't changed over the years. We keep doing it, and it helps to stretch out the back, take the pressure off of the spine. In a pool, you weigh very little, so just standing there, you're kind of in traction. You can hang onto the edge or onto a noodle or float with the feet off of the ground. That would traction the low back.
What about these tilt tables?
Exactly, that is another one. Inversion tables. They do provide traction. They're pretty good. I worry sometimes about people getting stuck or falling out or getting stuck straight upside down. We worry a little bit about pressure on blood vessels in the head, but they do serve their purpose. They're not too expensive for home use and tuck up and hide away. So they can definitely be a good tool to stretch the back. And you only do it 2 minutes, maybe 5 if you've done it for a while. So it's definitely something that's quick.
What was that?
An inversion table. It's this machine that you would purchase, and it's got a board on it. You kind of lean back into the board. You strap your feet in, your knees in, your waist in, all strapped to it. And then it has some sort of pull or lever where it's going from upright, you start to head upside down. You don't even have to go all the way upside down to get some weight off. But they're common home traction techniques. I know of a home traction that is this big box. You unzip it, it lays flat on the table, you wrap it around your waist and pump it with a bike pump. And it does traction. So many people have tried to figure out how do we get traction at home, because it's a good tool. Going from there, ideally, I think people should give physical therapy a shot. It's very conservative, can't hurt you, non-invasive, but should it not work or not be right for you? Injections, I've found from patients, can be beneficial. There's a whole variety of them. Sometimes they do cortisone, steroid type things, or epidurals, but they can be something that provides pain relief without surgery.
That's strictly a Band-Aid.
That's strictly a Band-Aid.
Sure.
Lasted.
So, and sometimes they do absolutely nothing. You get 3 in a row, and nothing is done. So they're variable. Sometimes we don't know exactly what part of the spine is giving us the pain. So if we try to shoot an injection in a joint and it doesn't work, well, the joint wasn't what caused us the pain. So maybe in a disc another time we try, or there can be some different areas as to where they do the injections, and that's all up to the injection
But
guy.
it was very, very short term.
Yeah.
3 weeks.
Yeah. And it's a lot to go through for just a couple of weeks.
Sometimes it doesn't work out.
Yeah. Then there's surgeries. There are laser, light, quick surgeries that they advertise. And then there's things all the way down to big fusions and cages and metal and screws. And that's all basically up to what your spine looks like and what the doc thinks will fix you. I know that people have asked me about laser spine things, and sometimes it doesn't work because it's not enough for you. Your back is so complicated that you need more than that. But it sounds good because it sounds like the easy kind of surgery. So things that help us keep our backs safe or keep our backs feeling better. Body mechanics and lifting type of things, along with positions. So ideally, we never want to do anything that puts us into too much backward bending. Takes that spine and compresses it. So even if you're carrying something, but it feels a little heavy, we often do this so that we don't have to hold it out in front of us. So being careful about any kind of weighted carrying. Bending to pick something up. Ideally, it should be all hip and knees straight back. If we bend straight from the spine, we're just putting a whole lot of pressure on these little spinal muscles and areas, and we're asking them to do so much when we have these big, thick legs that we can bend with. The number one way to herniate a disc is to pick something up and rotate with it. So you never want to leave those feet planted and rotate. So if you must, get up, you move. Even bending at the waist and rotating, taking from washer to dryer or whatnot, this can cause some injury to the spine. When sitting, ideally something that helps to support the low back so that we're not too slumpy. This is a simple towel, put a little tape on it. Stick it right above the butt into that crevice of the low back, and that can help support the whole posture and the spine itself in a more proper way. This is a lumbar cushion. This happens to be made of foam. They make ones out of mesh, and they're very supportive for the entire low back. I just found this on Amazon and printed it up with all the information. So feel free to come take anything when I'm done, but it'll be up here. And then sleeping. Sleeping on your back is best for your back. You're straight, aligned. Some people don't like that perfectly straight position. A little bit of compression on the spine. So what is great is this is a little leg wedge. It comes up underneath the thighs and then supports the whole lower leg. This takes that arch out of the spine and puts a little more comfort to the spine. When we sleep on our side, a lot we can develop bursitis or inflammation right at our hip bones because we're spending so much time compressing those hip bones into the mattress. It's something that typically is like back pain, bursitis. They come one, too. So to avoid any further pains and irritations, ideally on your back is best if you can. And it's hard to change our sleep patterns, but if you spend 10 minutes a day or night in a good position, that's 10 minutes and you did better than you did before. So hey, we do things in little measures. But so it's important to watch our daily positional postures. It's these little things that we do every single day that can add up to a lot. Bending to brush teeth, wash face. We don't want to just do it bending at the waist. If you feel silly and squat, then you're doing it right. If you're going to get a little water from those water jugs, and you're bending, squatting, you're doing it right. So just take time to think about how you're sitting, how you're set up, and just doing the best that you can for your back so that it will be nice to you in return. Oh. That's my spiel. So I want questions.
Upper back.
Upper back. Thoracic or neck?
Right there.
Right in there.
Yep, right there.
You want to talk to Mario? No. Mario will be doing some massages in that chair.
Okay.
The thoracic spine, where our ribs are, is pretty stable because these ribs keep us stable. But in between shoulder blades, we have a whole bunch of muscles. Our shoulders are only attached through muscles. So if it's right in here in that muscly part, you might have a knot in there, muscle tightness. Okay, that needs stretching.
Okay, I do that.
Yeah.
And it does help.
Heat is good.
Okay.
Get blood flow.
What about the neck, the cervical?
A lot of the same diagnoses happen in the neck. That degenerative disc, that stenosis, all the same thing. The more curve we have in the neck, the more pressure we're putting up here. So then a lot of neck stuff goes back to posture, which is hard. It's hard to change posture. We remember we pull the shoulders back, neck back on our body, and then we forget. But these lumbar rolls and back cushions help the neck a lot too, because they put that in a good way, which holds us upright. It doesn't let the back slump, letting shoulders and neck slump. Neck, you don't want to do a whole lot of backward bending. Same with low back, washing hair, drinking a can of soda. It's supported by a lot of muscles the same way. Instead of pain radiating to legs, we can get pain radiating to hands. They do cervical traction, massage, strengthening, that kind of thing. So it's really the same spiel, just a different body part. I mean, we're all connected through the whole spine. So it's a lot of the same. Anything else? Computer work can be, or sitting reading, tough on the neck.
And she probably, with the therapy, just moving it too.
Yeah, motion is lotion.
Yep.
One of our favorite sayings.
Because I was
When
like
we
this,
hurt,
I did therapy, and now I can.
when we hurt, we get stiff. When we're stiff, we go to move, and it hurts, and it creates this terrible cycle. And then I ask you to do motion. Oh, that hurts. But I say, you still have to do it. And then you do 10 of them. Oh, that loosened up. So, yes, ideally, with any pains, you still want to keep moving. You still want to keep going to your tolerance so that you don't get too stiff, stuck, weak, that kind of thing.
I've been getting it.
I haven't stretched for a week.
I know, because
when
we're
I'm
afraid of
sitting
your
on a
knee.
chair, or I could even be sitting, with my feet up on a sofa. When I get to go up, I'm kind of, it takes me a bit of herping.
Right here.
Is that relating to, is it
Right here.
No, right up, right here, sometimes here, sometimes in front.
And it just feels achy, stiff, sore.
Well, it's as if, it takes me a minute to be able to walk properly, weak.
And it's just when you're going to stand up from having
Yeah,
sex,
after having,
that should be inflammation.
right.
So when we irritate our body a little, we set, the inflammation can settle in, then we go to move again, and it kind of gets us.
Right.
So if you can, maybe one of those Aleve, Advil, ibuprofen kind of thing.
Yeah.
Hip joint problems should hurt in groin, and they should hurt with weight bearing.
Right, well, the next thing I was going to say, what I'm finding is I'm a wreck here, even lying in bed reading, I quite often sleep on my side, from side to side. I do sleep on my back sometimes, but I also sleep on my side quite a bit. But I do get it going into the groin, and it's as if I want to, stretch.
You need some leg traction.
Really pull out. Is that related? Is that all related to
Well, if it's hurting in bed, it probably won't be that
It's
joint.
uncomfortable. I wouldn't say
Pain.
pain. It's uncomfortable. No, it's annoying.
Yeah, I try to stay off of that side. If you're on the other side, a pillow between the knees. You want hips and knees to be even most of the time. You don't want to cross legs or anything like that. But yeah, it should be inflammation type things, and the joint doesn't sound involved.
Right. So, because I was thinking of having
Put a jacket on me,
I was going to have an entry. And then somebody said, well, the MRI shows up, it's not just the bone, it shows up the surrounding, i.e. you've got arthritis starting.
Yes, yes. Our X-rays just show bones. Sometimes the docs or the insurance companies make us do X-rays first, and then MRIs. But your MRI will show your soft tissue, your muscles, your nerves, everything.
Right.
That would give you true information.
Yeah.
But I try a little stretching, stretch knee to chest, laying down. You know, kind of see if we can get it moving comfortably. Maybe some medicines.
Yeah. Okay, I don't know if you take a lot of ibuprofen.
Yeah,
I don't take it.
Yeah.
I have, I do take the I probably should take, is nighttime better?
Yeah, if you're having your pain at night, I'd take it before bed.
Is it better to take the pills for maybe 2 or 3 days?
If you're really looking for an effect, you want to take a few days in a row. Let it kick in, be in your system. If it's an every 6-hour pill, try every 6 hours. Really see what it'll do for you. Give it a few days, up to a week. If it does nothing,
I have the stenosis, which actually I'm scheduled to go for an MRI again next Tuesday. I done physical therapy, no. But what's happening almost, I couldn't even count, 20, 25 times a day, it's locking up. Like, I mean, I can just be, say, getting out of the car, and then it's like,
it won't go.
yeah. Like, even now, I can feel it.
And
It's
it's
sitting
more out.
right here. Right where my hand is.
Out here.
Yep.
See, that's